Hello, my name is Lisa Warfield, and we're going to discuss the many aspects of wellness as part of IDS 402 with Southern New Hampshire University. First, we'll talk a little bit about the presentation outline we're going to follow. We're going to do an introduction, then we're going to address an issue, and then we're going to kind of review a plan for the issue that I'm addressing. First, we're going to talk a little bit. So, what is wellness? According to the Fairlex Parker Medical Dictionary, the definition of wellness is a philosophy of life and personal hygiene that views health not merely as the absence of illness, but the full realization of one's physical and mental potential as achieved through positive attitudes, fitness training, a diet in low fat and high fiber, and the avoidance of unhealthful practices, including smoking, drug and alcohol abuse, and overeating. There are dimensions of wellness. The first being environmental. Environmental is ensuring that you have a secure and safe environment, along with being a proponent of the environment to protect the environment as a whole. The second one is emotional. Emotional means having to be able to cope with life and having a satisfying relationship with your friends and your family. The third is financial. Financial will gives you the ability to ensure satisfaction with your current and future financial endeavors. The fourth is social. Social means having a sense of connection or belonging and also having a well-developed support system around you. The next one is spiritual, having a sense of purpose and having meaning within your own life. The next is occupational. Occupational is having, of course, satisfaction with one's job and career path. Physical includes physical activity, healthy diet, and good sleep patterns. Last is intellectual. Intellectual. Being able to participate in creative activities and work towards expanding your individual knowledge. And there are several social practices for force of social change. The first one is workplace wellness, and we're going to discuss a little bit why it's so popular. Workplace wellness is actually one of the most current social practices in today's society that addresses wellness, and it is very popular. It allows workplaces to motivate their employees to live a healthier life. It also gives them the ability to adopt that healthier lifestyle so they can save on the cost of their health insurance. Many companies offer an incentive to employees to quit smoking, to participate in lab tests so they can determine cholesterol is under the certain limit, or incentivize them to actually get the preventative services like well women, colonoscopy, breast exams. The second one is the Healthy People 2020 program, which is offered by the U.S. Health and Human Services through the Office of Disease and Health Promotion. The vision of the program is actually to create a society in which people live long and healthy lives. And they do that through the identification of health improvement priorities at the nationwide level, increasing public awareness, and provide an understanding of what causes disease and disability and what opportunities are available to prevent each of those, provides a measurable goal and objectives related to health at the state, national, and local levels, and strengthens policies to improve practices that are based on the best available evidence and knowledge. There's also the 7 benchmarks of a wellness plan. And this goes back to our workplace wellness. It often gives you the ability to get senior level support, which is always needed for any initiative within an organization, especially when it's related to cost. You have wellness teams that are responsible for developing the program and making sure that it is marketed throughout the organization. Making sure that you're doing data mining to drive the efforts, that data will need to be identified the needs and the interests of the employees. So you're not singling any set of employees out. Operations plan outlines the roadmap and guides the company's investment and efforts into the workplace wellness. Choosing interventions, making sure that the correct support and interventions are needed for the organization and its employees, like smoking cessation, proper nutrition, stress management, to name a few. Supportive environment is essential for to ensure your employees have access to the resources they need in order to practice wellness and a healthy lifestyle. And you always want to evaluate the outcomes to show participation, participant satisfaction, and the cost containment, just to name a few. Talk about a little bit of discipline and study and wellness. I actually work in the healthcare IT field, so the common detractor to wellness is, of course, stress. Workplace stress is where increased levels of job stress, as assessed by the perception of having little control but lots of demands, have been demonstrated to be associated with the increased rate of heart attack, hypertension, and other disorders. There are several different reasons why there's so much workplace stress. This could include juggling work and personal lives, concerns with job security, especially in today's society, interpersonal relationship with coworkers or management, and then of course there's always the workload. But there's also some causes for those that don't work inside a workplace. I, for example, work from home, so some of the extra stresses that I experience personally is an expectation of constant availability and the perception that it's less stressful than working in an office. There are several recommendations associated with lessening the stress in the workplace. Offering flexible work hours, especially for those that have families, so that they can be home with their kids or home with somebody they may need to take care of. Having more personable or friendly management. Everybody's had that manager that's been kind of strict, but making them more personable may make it less stressful for the employee. Being able to reward good work through a financial rewards or days off, and ability to work from home on occasion. But there are positive and negative aspects of wellness. The positive is why wellness is so important, because it enables prevention of some of the chronic conditions like emphysema, COPD, diabetes. But it also allows people to be active members of society and within the workplace. But there are some negative aspects to wellness. There are some conditions that are outside the person's control due to genetics. But although genetics can contribute to some conditions, knowing if it's a possibility can help with leading a more healthy lifestyle to stay off or prevent the actual condition from happening. There are some emerging technologies within the wellness area today. The first one is the Fitbits. Everybody has one. I personally have one. So we're going to talk a little bit about how technology relates to wellness. The Fitbit, there are several pros and cons of it in the workplace wellness program. There can be a cost savings associated with having the Fitbit, but it does give camaraderie. But the cost savings comes from the employer paying less in healthcare costs, and along with the employee having to pay less out of their pocket for healthcare. By living a healthy lifestyle, there is less out of pocket in getting treatment or monitoring for non-healthy related medical conditions. In addition, you also get camaraderie among the employees. You'll be able to exercise with others or in a group. It's much more enjoyable than doing it alone, so you're more motivated to do it. It also provides motivation by others to continue the program. There's also cons to it where you'll have, they can be actually a distraction, or the data that you're actually getting from your Fitbit could be improper. There's also another emerging technology is the internet and streaming services for exercise programs. Those make it easy for those to travel to be able to get access to their program. And it's also easier because you have the comfort of doing it in your home or with a group of friends outside of the workplace. dollars. SNAP